This morning's live stream will be continuing our series in AMH. This will now be the 7th live that we have done on this topic, and yesterday we covered AFC, which is also very relevant in terms of AMH. So we'll just dive straight into the questions this morning. Dr. Rusty, my first question for you is, what kind of confusions or misunderstandings are there about the AMH test?
Thanks everyone for joining the live stream. So it's very important to understand the types of confusion about AMH tests. So AMH test is one of the least understood fertility tests. As a result, it's not being utilized properly. So that's linked to the confusions about AMH tests. A lot of members of public, patients, even healthcare professionals do not understand the AMH test because of these confusions, and they ignore, and that's why this test is not being utilized properly. So there are two types of confusions. First one is a confusion about the test accuracy itself. A second is a confusion about interpretation of the test result. So this all jumbled up, mixed up. So we need to disentangle these type of the confusions about AMH tests. To disentangle, first we need to separate these two different type of confusions. Today we will be focusing on addressing confusions about the test, AMH test itself. We are not talking about interpretation of the results. On tomorrow's live stream, we will be discussing the confusions related to the interpretation of the test itself, the role of the test itself. So two confusions. One is a confusion related to the test accuracy. Second is the interpretation of the test result.
Thank you, Dr. Rusty. Some say that the AMH test is faulty. Is this an accurate assumption?
Not current generation, current AMH test. So there's been historically 3 different generations of AMH tests. First generation AMH test was introduced in 2006. It was in use until 2010. Second generation AMH test was introduced in 2010 and was used until 2013. So the third generation AMH test, which is in use, has been in use since 2013. Anyone who had a test 2006 to 2010 using Gen 1 AMH test, or anyone who had AMH test after 2013 can rely on the test results. I will explain where this whole disbelief or concern about AMH test came from. So back in 2011, when I was doing research on AMH test, I accidentally discovered that test was faulty. So that's called AMH Gen 2 test. So then we did a series of experiments with our research group in Manchester in UK, and we proved to the manufacturer and to the world that actually Gen 2 test was faulty and it should not be used. And we campaigned for recall of that test because at the time there was only single AMH test, Gen 2, which was being used across the world. I was concerned, of course, so many thousands of women were using AMH tests, using faulty tests. That's why we campaigned and asked to recall, withdrawal of that test. And we proposed solution to fix that AMH Gen 2 test. So, and did a lot of research papers and did a lot of publications and went on newspapers to report and asked the recall of that test. Eventually, this test was recalled in 2013, and that Gen 2 test was fixed using the recommendation which we made, our research group made from Manchester University. So, and they introduced our solution to fix that test, and the current test, Gen 3 test of AMH, is stable and reliable. Why? Because I know that we have done that research and we proposed that with premixing method to fix, and that company which manufactures AMH introduced that test. Personally, I have zero interest on any AMH test. I don't have any connection to any fertility company or fertility test. So as a part of my research, I discovered accidentally Gen 2 test was faulty, and I led campaign to recall, and it was recalled in 2013. So all settled for me, and the now current test is reliable. If you had a test from, let us say, 2014 onwards, you can rely on your AMH test. That's current generation.
Thank you, Dr. Rusty. Is it true or false that sometimes the AMH result can fluctuate?
So there's a natural variation of AMH, natural actually all hormones, all body parameters naturally fluctuate. Any blood test you do naturally fluctuates a little bit. So each test there's a different level of fluctuation. So the usability of the test depends on how much fluctuation you have and how much this fluctuation affects your management. So for AMH test, antral follicle count and FSH test, these three markers of egg reserve, AMH, AFC, and FSH. So there is approximately 30% fluctuation for all. Actually, this is one of our research, which was published in 2010 in Fertility Sterility. We proved what's actual expected fluctuation for AMH, AFC, and FSH. So all of them fluctuate by 30%. So the 30% fluctuation is very much acceptable in infertility treatment. Yeah, so there's difference between fertility screening and long-term prediction of the fertility in infertility treatment. I explain, let us say if you do AMH or AFC or FSH, you have a 30% variation. Let us say your AMH today is 10. Next time after 2-3 months, it may be 12. Next time it may be 9, for example. So that's approximately like 30% variation. So that's acceptable for infertility treatment because your doctor's treatment plan doesn't change whether your AMH is or AFC is a 10 or 9 or 12. So, and this is acceptable treatment for current management, not to predict how long you will stay fertile in terms of your egg reserve in the long term. But for the long-term prediction, you need to repeat AMH and AFC at least twice, maybe 3 months apart, then average out. Let us say AMH is 12, next time it is 14, then probably average is 13. So you can predict that approximately. I'm not saying exact year you can predict when you run out of egg reserve. You can estimate maybe 10, 15 years. You don't need to worry too much. So yeah, so if it is like 3 once, next time it is 4, so it's telling like 3-4 years your ovaries will be producing functional eggs, like functional egg reserve in average, maybe a little bit longer, a little bit shorter. So and yeah, so the variation is important, and that's 30%, and that as a doctors, like specialists, we take into account. We're making the decision about your IVF treatment or about any infertility treatment or long-term prediction of your fertility.
Thank you, Dr. Rusty. My final question for you before I go into some user questions is, should an AMH test be done during a certain time during the menstrual cycle?
So AMH test is doesn't get affected by days of menstrual cycle. Why? Because your ovaries constantly keep recruiting antral follicles. So number of antral follicles goes up and down 30%, but it's fairly static. Whether you are actually ovulating today or whether you having menstrual period today, it doesn't matter. So the antral follicle number is fairly static, and AMH is produced from antral follicle. That's why it doesn't get affected. So ovulation affects other hormones like estrogen, because estrogen is being produced from large dominant follicle. Then your LH is affected by menstrual cycle, because if you have large follicle, your LH goes up, and your FSH is affected by your menstrual cycle, because the role of FSH in the beginning, first like 14 days to stimulate your follicles. Your progesterone is affected because that's produced from ovulated follicle. These 4 hormones affected by the days of the cycle, because they get involved in the recruitment, ovulation, and production of progesterone of dominant follicle. But the like antral follicles, these are follicles less than 10 millimeters, do not get affected by your actual cycle. This is why you can do AMH test any day of your menstrual cycle.
Thank you, Dr. Rusty. Before we conclude the live, I just have two questions from our comment section. Meme asked, is there a way to increase AMH? And Sajina asked, is there a treatment for low AMH?
Okay, so AMH test is a reflection of egg resolve. Like we said, accepting 30% variation difference between measurements, and that's why you need to repeat, especially if you have a low AMH, if you're not doing treatment now. So repeat. AMH is like indicator of how much of reserve you have. Tomorrow we will discuss about this confusion. So AMH test is egg reserve test. Yeah, so it doesn't tell everything about your fertility. It tells about your egg reserve level, quantity, not the quality of your egg reserve. It tells quantity of egg reserve. It doesn't tell precise number and how many eggs you left, but it can tell you have a high number of eggs left on your ovaries, low number of eggs left, average number or low number of eggs left. That's sufficient information for you to plan your future fertility, current and future fertility. So an AMH test is a reflection of egg reserve, and egg reserve, unfortunately, once it's created, then you gradually run out. You can't create new eggs. But AMH is you look at the AMH level and you tell whether you have a high, average, and low egg reserve. Then you should repeat. If you have a low AMH levels, then you should do antral follicle count, and you need to have a full fertility workup and understand your current fertility and your future fertility. And then you need to make a plan for your fertility. Let us say, for example, if you're ready to have a child, if you are in a relationship with a male partner, then you should try and complete your family quickly before you run out of egg reserve. So, and if your AMH is high, then you have a longer time in terms of your egg reserve. Yeah, so AMH is test of egg reserve. You cannot artificially increase AMH levels, but naturally it can go up and down. You know, and a lot of confusion came from the fact that when you use some type of diet, or you use some type of drugs or DHA, all these things, if you measure twice, sometimes you see it's going up. You think it's actually with diet or DHA, whatever you're taking is making it. No, it's actually natural variation. Anyone without doing anything, if they measure AMH levels 2-3 times, can go up and down. That variation in average is 30%. In some patients, it may be higher. You may have more than 30% variation. So in outliers, outlier means that your result can be different than average. But if this is the case, this is why you need to repeat, especially if you have low AMH. If you need to repeat twice, maybe 3 times, and do antral follicle count, then you have a very good understanding of your egg reserve. So AMH is a signal that your reserve is going down. If low AMH is a signal, your reserve is going down. So tomorrow we will discuss. A lot of patients with low AMH have a natural conception. They don't even need IVF, provided they're trying to conceive now actively, and their partner doesn't have any fertility problem. They don't have any other fertility problems like tubal factor infertility, severe endometriosis. They can conceive naturally, because AMH, presence of AMH means you are releasing eggs. So, and so in some patients, a lot of patients conceive with IVF, and so even with a very critically low AMH, a lot of patients conceive with IVF. IVF is preferred if you're not successful, because in IVF you can go multiple times faster than natural conception. So it's impossible to tell what's the right approach for each person, and we can give overall view, but when we see the patients, we take everything into account, then make recommendations. Your plan A, plan B, plan C. So we put various options, then pay couples or patients say, okay, I now understand what's my egg reserve is like, and what are my options. Then they select and go ahead with the most optimal solution for their fertility.
Thank you so much, Dr. Rusty. That does conclude our live this morning in our part 7 on the AMH series. So thank you so much to those that joined and for your questions in the comment section. As always, the recording of this live will be published on Dr. Rusty's YouTube, TikTok, and Instagram. And we'll see you tomorrow morning for our continued live in the series. Thank you so much.
Thanks, Gabby. Thanks for organizing this live stream. Thanks, everyone, for joining. Thank you. See you tomorrow.